Soon enough. With pressure on hospitals likely to build over the winter, it's unlikely that Addenbrooke's will be the last to crack. Thomas Moore, Sky News.
Let's talk to Rob Webster, Chief Executive of the NHS Confederation. Good evening to you. Addenbrooke's is such a renowned, very well-respected hospital. If this can happen there, what does this tell us about the rest of the NHS? Or can we even make those comparisons?
So I think what we can say about Addenbrooke's is that it's just an example of significant pressures that there are across the system at the moment. What our members tell us, we've got 550 different organisations in the service that work with us, is that they've never felt pressure as great as it is today. And some of that's because of the way that other bits of the health and care system work at the moment.
Such as?
We know at the moment there's a big problem with too many frail older people being left in hospital because there aren't alternative services for them to go to. They'd like to be at home, we'd like them to be at home. So we need to invest in social care services, which are in significant crisis. We need to invest in prevention, and we need to make sure that when we look at what's going on in hospitals, we think about the root causes, which often are outside the doors of the main gate.
What we have certainly heard about Addenbrooke's is that the CQC said the quality of care there was excellent. So yes. Perhaps people are going to be alarmed for the wrong reasons. But they're laying the blame at the door of management. Is there a sense with all of this, and across trusts across England, that actually these changes people are having to be more efficient and the management just aren't dealing with it correctly?
There's a revolving door of management in the NHS that's got to stop. What we have are a group of committed, able people who've got two big jobs to do. The first is they have to respond to the pressures that are real and in the system today. And the second is that they have to look at how we change services to better meet the needs of patients in the future. So we know there are more frail, older people, more people with more than one condition who need ongoing care and support, and services need to change to deal with that. What they tell us is that the job's never been tougher, and that's partly because they feel that the environment they're working in, with the regulators, with scrutiny, and with others, is potentially toxic and often unforgiving. As you change services, there will be things that you have to go through in terms of how care is delivered, and change is always difficult. We need to support managers working closely with clinicians to make change happen for the benefit of patients.
We are in a situation though, aren't we, where, we all know things are changing and have been changing over the last 5 years. Is there a sense that whenever something goes wrong, a lot of people stand up and say, we need more money, you've got to throw more money at it, and with the best will in the world, the NHS is a bottomless pit? That isn't a simple solution, is it?
This isn't just about more money. What we need to do is reverse the cuts in public health expenditure that have been made, and we need to fund social care appropriately so that NHS care can flourish and survive. All people working in the service want to deliver better care, and what we're seeing is a revolution in the way that care is delivered in many parts of the country. So if you go to Northumbria, Newcastle, Newquay, what you'll find is people starting to change the way that care is delivered. So it's not just about the money, but the money that you're putting in, if there's not sufficient to meet the needs of patients, particularly in social care, then what we'll have is a failing NHS.
Are we, just briefly, do we have an NHS in crisis or not? Because a lot of people would like to say that, and I wonder if from your perspective that is a fair analysis or not.
We have an NHS which continues to be the most efficient system in the world, which delivers the best access in the world. And what we need to do is back the NHS over the next 5 years with a long-term plan that's appropriately funded and back the leaders to deliver it. If we don't, it will be in crisis.
Rob, good to talk to you tonight. Thank you.